Welcome to this webinar with frequently asked questions about routes of immunization. What will we discuss today? Today we will talk about 6 frequently asked questions regarding routes of immunization. First of all, why do we immunize? Secondly, how do cultural or regional differences affect the choices we make in routes of immunization? The third question will be, are there new or emerging routes of immunization that are under research? The fourth question, why do we use different routes of immunization for the same disease? Is one route better than the other? And finally, which route of immunization is the safest? First, let me introduce myself. My name is Lieke de Vrankrijker. I work as a pediatric infectious disease specialist at the Wilhelmina Children's Hospital in Utrecht in the Netherlands. I did research on the interaction between bacteria and RSV in cystic fibrosis patients. First, before we start, I would like to clarify what we mean by using the words vaccination or immunization, because they are not entirely the same things. First of all, immunization. Immunization is a process. It is the process of getting an immune response in the body which will protect a person from future infection. Vaccination is different. Vaccination is a means of getting the body stimulated to make an immune response directed at a certain pathogen so that in future the person will not become infected or not severely ill when they encounter that pathogen. So it's important to realize that they are actually 2 different things. And I wanted to point this out before we continue with this webinar so that you know exactly what we mean when we talk of immunization or vaccination. So there are different routes of immunization. Firstly, the intramuscular route. The second route is intranasal administration. The third route is oral administration. And then finally, a new route, transcutaneous immunization. Why do we immunize? I think it's important to realize why we do this. There are 2 reasons to immunize for a certain disease. Firstly, it would be to protect the individual. For certain diseases, we immunize the patient to protect them from getting ill or getting severely ill from a certain infection. But a second goal of immunizing might be protecting the public, so it would be a public health goal. And I've included a schematic of how you would see this concept, which is called herd immunity. So let's say there's an infectious disease for which only very few individuals are protected by immunization. Should the infection spread within that population, it will very easily spread because there are hardly any persons who are immunized for it. So they will spread it to the next person, who will spread it to the next one, and that way the infection will easily spread throughout the population. If there is a high immunization rate within the population, it means that a lot of people in the population will not be able to become infected by the disease because they are protected. And this means that not only those people who are individually immunized will be protected, but also other people in the community who, for instance, are not able to be immunized or who are too young to be immunized yet. And we call this herd protection. So how do regional differences affect the choice of immunization routes in patients? There are a couple of regional differences that we take into account. First of all, the infrastructure of the healthcare. So in order to give a certain immunization, you need trained healthcare workers, but also things like cold chain systems, especially for intramuscular vaccines. It is very important to cool the vaccines until right before you can administer them. And this might offer problems in areas that are difficult to reach. And then, of course, there's the cost aspects. Certain vaccines are more expensive than others to produce or to distribute. Another aspect is cultural differences. Within certain cultures, vaccines like intramuscular vaccines might be more acceptable compared to other vaccines. And then finally, the prevalence of the disease plays a role. So how often does a certain infection play a role in that certain population? So are there any new or emerging routes of immunization that are being researched? Definitely. I'll discuss two new and emerging routes. First of all, intranasal vaccines. You may already know the influenza live attenuated vaccine that is administered through the nose. But there are a lot of other respiratory pathogens for which research is ongoing onto whether or not they can be immunized by using the intranasal route. The most important advantage of an intranasal immunization is the fact that it also offers local immunity. So it could be very important in viruses that enter through the nose. And then transcutaneous vaccines are also a very new research development. It is an important research focus, mainly because it was found that the skin offers many immune cells, and this way these vaccines might offer a very strong immune response. And one of the developments is research regarding a vaccine which can be administered through a patch that you can put on your skin, which has certain microneedles in it, thereby introducing the antigen of the disease into the skin, presenting them to the immune system. But why do we use the different routes of immunizing for the same disease? Several diseases for which different routes already exist, I have already told you about. For instance, influenza, which you can administer through intramuscular vaccines or the intranasal route. And for instance, the polio virus also has an oral route and the intramuscular route. So in order to decide which type of immunization you would use for the disease, you have to take into account certain aspects. So there are several general aspects, for instance, the ease of administration. You can imagine it's very easy to administer drops or a spray in the nose or in the mouth compared to having to insert a needle into somebody's muscle. Also, costs play an important role, and this also incorporates the use or the need of cold chain systems. The type of disease also plays a role. I told you before that for respiratory diseases, it might be an advantage to generate a local immune response in the mucosa, for instance, with influenza vaccine. And possibly, by giving intranasal vaccines, it might also lead to lower transmission of the virus should a person come into contact with it. For the polio virus, transmission also plays a role because the oral vaccine will lead to a local, strong immune response. So is one route better than another route? When you compare the different routes, you can look at the strength of the immune response. I already talked a bit about this. So we know that the oral and the intranasal vaccines mimic a natural route of infection very closely. You can imagine that the way that the immune response is evoked in case of, for instance, an intranasal vaccine is similar to that of the influenza virus, which also would enter through the nose, for instance. So if you get a local and a systemic immune response, this might be beneficial for certain infections. Also, the type of immune response that is evoked might lead to the secretion of local antibodies, which is also important in, for instance, polio virus. And then finally, for the transcutaneous route, this is a very promising route, also because there are many immune cells in the skin, so it might lead to a very strong immune response, but also because it might be a very easily administered route of immunization. And then, of course, we have to take into account the costs and the practicalities. We know that the mucosal vaccines, so the ones that you give through the nose or the mouth, are cheaper to produce. They are very practical to administer. And especially in children, this might be a very important advantage. Another aspect to take into account is the absorption. We know that for intramuscular vaccines, absorption is great. This might be different for the intranasal vaccines or the oral vaccines because it depends on the amount of antigen that you are able to administer in that route of immunization. And then another important thing is the acceptance of the intramuscular vaccines. In some countries or cultures, intramuscular vaccines might be more acceptable because they are very known and well-known routes of immunization. So which route of immunization is the safest? What do we know of safety? First of all, let's discuss the infection risk. We know for intramuscular vaccines, we need sterile needles and syringes in order to avoid any infection from the fact that we puncture the skin and put the needle into the muscle. For oral vaccines, I already said before that, for instance, for the polio virus, the live attenuated vaccines might lead to shedding of the virus. So this is also something to take into account. With intramuscular vaccines, we have to consider the event of a hypersensitivity reaction. The risk of this is small, but we also always have to think about it and discuss it with the patient. And then finally, local irritation. We know that local irritation is very common in the intramuscular route. It's often very short-lasting. And we know from the transcutaneous research that has been done that sometimes the patches might lead to some skin irritation. So all of these factors need to be taken into account when we choose which type of immunization route we would pick. So finally, we will talk about patient communication, how to talk about all these routes of immunization with patients or with parents. So the most important thing in discussing immunizations with patients is to be open and clear regarding immunizations. So tell people how they will be administered, how they work, make sure they don't have any questions about that left. Also, it is important to ask patients about any questions or doubts they might still have regarding these immunizations. And don't stop after just asking one question, but ask them more and also refrain from correcting them immediately. Just give the patient room to express all their doubts and talk about what they have read or have heard about these immunizations. Be sure to listen and acknowledge their concerns, but also be non-confrontational. So sometimes a patient might say, I don't want immunizations, but it is not always the case that they don't want to discuss it anymore. So it might also be an opening to discuss it with them. Ask them, why do you not want these immunizations? So, and then finally, our key takeaways. So there are 4 routes of immunizations that we have discussed and of which we have discussed the most important questions. So first of all, the intramuscular route. Secondly, intranasal. Thirdly, oral. And finally, a new development, which is the transcutaneous immunization route. Thanks very much for your attention.